is a video for someone with lumpectomy or mastectomy after breast cancer. Maybe the scar's a little bit stuck, or maybe there's a little bit of swelling or edema around the breast, around the scar. Perhaps some sort of tenderness. Often when lymphatics get a bit stuck, then it gets a bit tender. So I just wanted to show you a couple of techniques just to do a bit of lymphatic drainage and a little bit of scar work just to help with that in between your sessions for when you see someone like myself for scar work or lymphatic drainage or whatever. So first of all, you're going to pump the nodes in above your collarbones. You've got in this little triangle here, you've got the supraclavicular nodes, which are the big ducts that drain the whole body. So I find it easier if you cross your hands over, use your two fingers. You can feel if you're in the right spot. If you lift your fingers up, your fingers fall into a little hole. Lift your fingers, lift your shoulders up. Okay, and back down, and that's the spot. So you're just going to do on, off pressure while taking some nice big belly breaths. There's lots of lymph nodes in the tummy, so you want to just squeeze those nodes with your diaphragm as you breathe. So do this for about 10 times. On, off, quite a light pressure. You don't need to be firm, the lymph nodes are just underneath the surface there. And then same on my left side, my affected side, you're going to do a little cup with your hand and just get into that little cave underneath your armpit. Again, mindful breath. 10 times. I would do the non-affected side too, just wake up that channel. So these are like your buckets, the collecting stations underneath your arm here. You've got a few spread around the body, but for the arms, this is where we drain. So you want to empty your buckets, empty the fluid in this space, so then when you move fluid, it's more easily taken up into that space. Okay, so this you would do on your skin without a top on usually. And then with no cream as well. So with the breast drains from the top, it drains up to here often. The middle comes towards the sternum nodes here, and the underneath inside the breast will still go up into the axilla, even if you've had lymph nodes removed, even full clearance, you'll still go into deeper channels there. So you're going to start at the top, just some nice dragging over the skin, nice and slow. You can also do some, we've got the nodes in the sternum, wake up those mediastinal nodes. Okay, then we're going to drag, all that sort of up first, and then you sort of working your way down. So the inside of the breast, come towards the sternum. You can bring a little bit over to the side, not that it sort of crosses that very much, but you know, spread the love. Okay, bringing that breast inside. If you've got a large breast, just sort of pick it up so you can get underneath it. So you're going to start dragging at the top of the breast foot here first, because it's like, you know, this is your only exit, and this is like a car park of cars. You've got to clear these before any of this can be cleared. So you're working backwards. Okay, so you're dragging up the side of the breast, into the armpit, excuse my dog, underneath the breast. Okay, every now and again you can have another little pump. Now a little pump. Okay, and keep on going. So if you've got some swelling at the side of the breast, often it'll sort of collect around where the scar is. You know, just give that a little bit more attention, or if it's sort of collecting around the lateral breast here, just give that a little more strokes. And you have to do this for a few minutes each day. Okay, so dragging under and up, dragging in, dragging up. Okay, 5 minutes really. I've gone a bit quick. Just do a bit, you know, a few minutes, whatever you can manage, better than nothing. Okay. All right, if you've had radiotherapy on your breast, actually I'll show you some scar work first, because the radiotherapy is used cream. So then you would do some scar work. You can do this at different times of the day too, the scar. So now you've got a scar on your breast, and you've got a lymph node scar. So now the scar is, you know, I'm just going to show you on my arm here, but pretend that, you know, that's on my breast sort of thing. So now that's the scar where I've made red there. So then just little circles on top of the scar. Okay, but you're not just working on skin. all right, you're actually trying to influence the tissue underneath it. So little circles, and you can start taking it into a few different directions. Giving it a little pull, push it away. You sort of get on the wall of it. You know, so send out the scar. I'm getting right on the edge of it now. I'm pushing into it. Other side. You know, trying to make a little C curve in the scar. Pick it up if you can. Often when scars are really tight and adhered, you can't pick them up. But if you can, just start trying to ease it from the tissue underneath it. Just give it a little shimmy. Okay, pick it up, pick it up. All right. And then, you know, clear away. If it's on your breast, you know, every now and again, just give it a little clear if you've shifted any lymph from underneath the scar. And then, okay, so you've done that, you've done that. Now you can roll over it, all right? You sort of roll over it. Okay, and the other way, roll over it, roll over it. And then you do the tissue sort of around it as well, because scars are like icebergs. They're not just what you can see on the surface. There'll be layers of scar in there, especially on the breast too. Often you've had, you know, a lot of the new surgeons do the nipple, where they take the nipple off, and then you've just got internal scarring, and that's, even though you can't see it, there's still scar in there, and you'll feel it as like hard lumps. So you can do this sort of stuff on them too. I do a different technique for that. So if you have got internal scarring, it's best to come and see someone who does scar work, because they can be a bit tougher to treat. But anyway, you know, massage is going to help soften all that anyway. Okay, so you've massaged your scar, a couple of minutes, you know, just when you're watching telly, whatever, a couple of minutes, and then clear away. Okay, clear any lymphatic that you've moved from that area. You know, you've worked underneath the lymph node scar. Sometimes the tumours close to the outside of the breast, they'll go through there to get the lymph nodes, and then it's actually that whole channel will be sometimes quite sore. So you sort of want to work that whole channel that goes towards the lymph nodes. Find the sore bits, you know, and just gently sort of massage them. All right, and then clear your buckets at the end. You know, you've filled it up with fluid now. Clear your buckets, or clear your ducts at the top. Nice breath. Okay, so that really should just take you 5 minutes. At a different time of the day, or in the shower, or after you shower, get some cream on your breast if you've had radiotherapy, because radio can thicken the tissue. So you just want to keep it soft, but it does build back up, so it's not going to last. But if you can do this at least after you sort of about 3 weeks, a month after radio, you can start massaging the breast. Same with the scar, about 4 weeks. When it's sealed, you can start doing that. But for the radio, you know, this is my breast, get your cream on, and you're sort of doing a bit more of a kneady sort of action, you know? You're getting into it a little bit more with the cream, massaging it all around, finding the thicker bits, giving it a bit more of a knead, and then, you know, for good measure, just bring it up into the axilla. Okay, so that is a quick sequence that you can do after surgery for breast cancer, lumpectomies or mastectomies, just a little bit of scar work and lymphatic drainage. Even if you don't have any swelling, it's good just to keep all of that moving through the scar, because the scar can act like a dam, and things can get a little congested and then can get a little tender. So if you just do that each day, even if it's just 2 or 3 times a week, it will really help. Okay, cheers, bye.